Hello, I will be discussing about LGBTQ and mental health. What is the global scenario and the Indian situation? I am Dr. Nikhil Nair. I have done my post graduation from Central Institute of Psychiatry and currently I am assistant professor at School of Medical Sciences and Research, Sharda Hospital. So, before beginning, I would like to thank FreePic and SlidesGo for the infographics. Now, I will be covering my topic under the following headings. So, terminology, it is very important. There are so many terminologies, very much confusing, so they need to be clarified. What is the historical perspective? Mental health issues, why are the mental health issues and what are the mental health issues? Demographics, measures by the governments, current affairs, and what is the way forward? So, terminology, if we see what is biological sex. So, biological sex is the which is assigned by the medical professionals at birth based on the appearance of genitals and the related assumptions about the chromosomes. So, it can be male assigned at birth or the female assigned at birth, or it can be ambiguous genitalia. That is, it cannot be classified into male or female. Gender identity is how a person feels for him or her. So, either a male or a female, and it is not necessary that it can be same as biological sex. Sexual orientation is whom we are attracted to. So, biological sex is the based on genitals, identities, what we feel of ourselves, and orientation is whom we are attracted to. Now, these three can be in unison or it cannot be in unison with each other. So, how they differentiate, if in unison or not, we'll discuss in the slides ahead. So, if we classify broadly, it is cisgender and transgender. Now, cisgender, as the name suggests, the biological sex is in unison with the gender identity. They are also called as straight or heterosexuals. So, if a person is having a male genitals, he feels himself to be a male. This is cisgender. Transgender, whose gender identity differs from the biological sex. That is, a person having male sex but feeling as female. That is, a female trapped in a male body. So, this is transgender. Now, the other synonyms or other terminologies are transsexual, gender dysphoria, or GID that we will further discuss ahead. This is a graphical representation for the same. So, identities, what we are thinking, attraction, and biological sex. So, coming to the terminologies, these are very important, often confusing, overlapping. So, first is lesbian. Lesbian is a woman attracted to women. Second, gay. Gay refers to men who are attracted to men but can also be used as an umbrella term for the entire community as a whole. Bisexual, that is, who are not only attracted to their own gender but also another gender. They are also called as bi men or bi women. Transsexual. So, transsexual people are those who experience a gender identity that is inconsistent with the assigned sex and they have a desire to permanently transition with the help of medical assistance. They are called trans. Then, queer. Gender queer, again, umbrella term for the gender identities that cannot be classified into male or female. And last is intersex amongst the major terminologies. So, intersex, it is the term used for individuals who are born with biological characteristics, that is, gonads, genitals, or chromosomes that are not associated with classical male or female. So, ambiguous genitalia is the intersex. Now, asexual, they experience little or no sexual attraction. Aromantic, similar to asexual, little or no romantic attraction. Demisexual, who feel sexual attraction only if they establish a strong emotional bond. Gender fluid, whose identity shifts or fluctuates. Okay, whose identity shifts or fluctuates. That is, they feel sometimes masculine, sometimes feminine. Gender neutral, who do not prefer to be labeled as any particular gender. And pansexual refers to attraction to all despite gender boundaries. That is love or attraction beyond gender identity. So it is beyond gender identity. So I will be discussing in detail about the trans population. Now somewhere you will see it is written as transsexual and somewhere as transgender. So broadly the meaning says that there is discrepancy in biological sex and gender identity. That is what is biological person has characteristics and what the person feels. So what is transsexual, what is transgender? So broadly speaking, transsexual is considered an outdated term and sometimes pejorative also. The general shift is to use that term transgender. However, some people who pursue medical assistance to change their sexual characteristics, they prefer the designation as transsexual because they have changed their sex, okay, with the help of medical assistance, and they reject the term transgender. And transgender are those people who do not prefer SRS. That is, so a classification amongst this is transsexual is an older term, transgender is a relatively new term. Transsexual is usually used by those people who prefer medical assistance or change in their sexes, and transgender who do not prefer SRS. So the other terminologies are trans man, that is biologically female but identifies as male. So trans men, they are also called as F2M or F2M, that is female to male. Then trans woman, that means biologically male but identifies as female. So this is trans woman. Similar to the trans men, they are called M2F or MTF. Now, clinically, if we see gender dysphoria, so gender dysphoria is the distress. Okay, this is the distress a person experiences due to mismatch between the identity and the biological sex. Previously, it was also called as gender identity disorder, and in ICD-11 we call it gender incongruence of adolescents or adults. So the transsexual or transgender is a term that where there is discrepancy. The distress that is caused by the discrepancy is called gender dysphoria, which was previously called gender identity disorder, and gender dysphoria is the term for DSM. In ICD the 11, the latest term is gender incongruence of adolescence and adulthood. So it is not a disorder, okay. This is not a disorder, but still it is classified as a sexual health condition because this continues to enable healthcare system to provide healthcare needs related to the gender. Intersex, so their biological sex do not classifies into either classical male or female. Okay, so they are also called as UAAB, that is unassigned at birth. So there is discrepancy in external and internal genitalia, ambiguous genitalia, discrepancy in phenotype and genotype, chromosomes, gonads and hormones. So other terms which were used previously but now obsolete are hermaphrodites and congenital eunuchs. These are not used now. There can be various causes for this. Some of the common causes are such as CAH or the congenital adrenal hyperplasia, then Klinefelter syndrome, trisomy X, Mullerian agenesis, androgen insensitivity syndrome, etc. etc. So there can be multiple causes of this ambiguous genitalia. So she-male term, often you must have heard she-male term. So she-male is a term that is used in pornography. It is not a medical term. So refers to a person who have both penis and breast, which is mostly acquired after medical assistance. In clinical settings, intersex clinically is also called as DSD, that is disorders of sexual development, and it is the population of this intersex basically which face infanticide, abandonment, rejection and stigmatization from the family members and society. Now the Indian and the South Asian population, another community, the terms which are used as the Hijra or the Kinnar, the community itself prefers to be used as. So what amongst the definitions or the terminologies that we have discussed is covered under Hijras. So Hijras are basically eunuchs, intersex, transgender who live in a community. So intersex and transgender, they both are covered under the Hijra community. So they are also called in various areas, regions as Skinners, Kothi, Aramni, third gender by the Supreme Court itself. Now amongst them also there is a classification of Khusrapan and Zananapan. So Khusrapan, they basically include intersex. Okay, Khusrapan, they are those with ambiguous genitalia and they are involved mostly in rituals, ceremonies and dancing. Jananapan, they are basically trans women, that is biological male but identifies as female, and they are mostly involved into sex working and begging. So as you can see that Hijra contains both intersex and transgender. So there is a common misconception that they cannot have relationship, they cannot have sex. This is totally wrong. And because the second category, which include the trans population or the trans women, they are sexually active and they are in a relationship. So what are the timeline of events? See, initially belonging to any of the LGBT community was considered a sin, a crime, and in India the Britishers labeled it as criminal tribes. Okay, as per various sources we see they called it as a criminal tribes. But later, based on various studies at various centers and levels, they documented a high prevalence of same-sex feelings, prevalence across various cultures, various investigations including psychological tools, and it was found that they do not have any objective psychological dysfunction, impairment in judgment or capabilities. So the movement various started. So it was the Stonewall riots in 1969 that led to that movement in a very large scale, and it came into limelight. So DSM in 1973 and ICD in 1992, they discontinued labeling LGBT as a disorder, and they identified as a normal variant of it. Considering India, the first movement was started by the NAS Foundation in Delhi, and Delhi High Court in 2009. They basically ruled that Section 377 is unconstitutional. It was initially upheld by the Supreme Court of India, but later on Supreme Court in 2018 also gave the verdict that Section 377 is unconstitutional, though bestiality still remains in that part. And current discussions are on the same-sex marriage. So why are we discussing about mental aspect? On one hand, we are seeing there have been so many dramatic changes, so many a change for a better of this population. So why are we, if things are so much better, then why are mental health concerns so much urgent? So there are 2-3 models for this. So the most commonly widely accepted is the minority stress model, which was given by Mears in 2003. So by minority, we often consider a religious or ethnic minority, but this community also forms a minority, okay, which is called sexual minority. So LGBT belong to sexual minority. Now, as a society, we have been exposed to the idea since beginning that heterosexual is very much accepted and normal, because majority is heterosexual. So this very idea of normalcy, it itself can lead to discrimination, that homosexuality is not very normal and thus not accepted. So it states that the model states that there are 2 types of stressors: distal stressors and proximal stressors. Distal stressors are external actual stressor, be it stigma, prejudice, rejection, verbal transbashing, abuse, brutality. So these are distal stressors. Proximal stressors are the byproduct of distal stressors. Due to this external objective stressors, the stressors that are that because of this are the proximal stressors. So concealment of one's identity, because that person may have to feel the digital stressors, vigilance and anxiety about prejudice, fear of coming out, internalized homophobia, shame, helplessness and isolation. So you can imagine the persistent mental stressors, be it distal or proximal. If they are persistent stressors, they are definitely giving rise to mental health concerns and issues, which can be substance abuse, self harm, depression, anxiety, physical ailments, risky behaviors, and lack of sex education. Second theory, which states that the age of coming out, that is the age of accepting it, is has reduced from 20 to 14. The age of coming out is accepting, telling others, and identifying yourself. So it has reduced from 20 to 14. That is, it earlier it was in late adolescent or early adulthood, but now it is in the early teens. Now this has been seen that early adolescent period. So they report strong prejudiced attitudes and more frequent homophobic behavior as compared to later adolescents or early adults. So when they are identifying at an early age, they are more prone to homophobic behavior, and that is why they are they must be uh, more likely to face peer victimization, and that is why they have more psychological consequences and must be looked upon. Now third theory, this is social selection hypothesis and social causation hypothesis. So this is obviously selection hypothesis. It states that they have some kind of traits. This minority population have some kind of traits which makes them more prone to mental health issues. This is obviously not widely accepted. Social causation is theory states that they face difficult social situations that lead to mental health issues, and this is more widely accepted. So these are the three major theories that causes more mental health issues and more mental health concerns in the LGBT population. So apart from this, what some factors which are specific to Indian context. See, we in metro cities there may be discussions, there may be participation from the other sections of the society, there may be parades, meetups, online discussions, but rural India have their own ways of dealing. So what are the challenges, what are the issues there? There are secret honor killings. Okay, so the only option left for this population is to run away. Second, family sanctioned corrective rapes, physical abuses, restrictions in dressing, interacting, forced marriages, and many times it is considered against the religion. These are practices which are considered against the religion. So in Indian context, there are rural India have their own set of issues. Now, what is the how much is the prevalence of mental health problems? What is the how much population suffers and all? So according to APA official data, 4.5% of the population is LGBTQ. So considering the total population, it comes out to be around 1.4 crores, and of these 39% have one or the other mental illness. So overall 39% of the LGBT community in USA has mental health issues, which comes out to be near around 55 lakh. Okay, it comes out near about 5 million people have uh, mental health issues. As there is no such official Indian data, collective India data, only one affidavit which was filed before the Supreme Court. It states that India has in 2011, India at that time had 2.5 million, that is 25 lakh gay population. This was on self declaration, actual number definitely much higher. So notable studies and surveys done up to know the exact percentage of the LGBT community. So Ipsos Pride study conducted in 27 countries The Indian data, however, was very less. It was only 500 sample size, though they claim that it was the representative of the population, but still the sample size was very less. And as per this study, the Indian data states that in India 3% are homosexuals, 9% are bisexuals, 2% transgender, 1% pansexual, and 2% asexual. This is as per the IPSOS study, which was done in 27 countries and in India done on 500 sample. And this is the data that they have given. So this is the graphical representation for the same. Difficulty in estimating what are the issues that causes difficulty is the associated stigma, underreporting due to this, failure to distinguish between desire, behavior, and identity. So these three factors have led to difficulty in reporting and the census. So that as such there is no official Indian data that compiles the entire population of LGBTQ. So overall, in a nutshell, it has been seen that LGBTQ are twice as more likely to have, as compared to heterosexual population, to have mental health disorder in their lifetime. So it is twice more common in the LGBTQ population. So if we say the LGBTQ, so it is and heterosexual, it is twice more common. Okay, twice more common in LGBTQ. Now this is the graphical representation for the lifetime rates of mood or anxiety disorder in women, men, across bisexual population, gay men and heterosexual. And you can clearly see that compared to the heterosexual population, both bisexual women, men, gay men and lesbian have a higher prevalence of mood disorders and anxiety disorders. Similarly, in the coming of graphs, you will be able to analyze that the prevalence of mental health disorder in the LGBTQ community is much more higher than the heterosexual community. So these are the graphs that tell the same picture, be it substance use in women or men, risk of suicide again higher. So another study which was done in the United States was the Trevor Project study, which was done in 34,000 population, which was a large sample size. And according to their data, again you can see that amongst the entire LGBTQ community, so rates were quite high. You see, across the various LGBTQ subdivisions, the rates of suicide in past year and attempted suicide was much higher. Similarly, for anxiety and depression, who reported physical abuse and who have experienced discrimination. See, such a high percentage, approximately 70 to 73% in lesbian and gay population. Again, population who could not access mental health care, very high population. Almost 50% had fear in discussion mental health concerns. So summarizing the Trevor Project, American Psychiatry Association, IPSOS and the CDC, Center for Disease Control. So in a nutshell, if we compare the major mental health issues, so it says that suicide is nearly 3 times more common. Suicide is 3 times more common, anxiety is 2.4 times more common, then overall mental disorder twice as more common, and substance abuse is again 2 times more common. Okay, so all mental health disorders are much more higher as compared to the heterosexual population in LGBTQ. Now, Indian studies, there was a meta-analysis which was done by the authors mentioned on the screen, and it considered 22 reviews, 4 viewpoints, 7 editorials and 60 original articles, and it was published in Journal of Psychosexual Health. And they have comprehensively analyzed all the studies and tabularized the data statistics. Summarizing, most of these studies that they have seen or they have mentalized are done in MSM, that is men having sex with men or the gay population. And to summarize it, the data states that uh, in depression anxiety, almost 30 to 70% had a lifetime of diagnosis of depression. Schizophrenia and bipolar disorder, no such difference with the other general population. Suicide 32 to 50%. Substance abuse 2.5 to 4 times more common compared with their non-transgender peers. Violence 65 to 98% had faced some or the other kind of verbal abuse. So these are the various data on the uh, mental health issues in the Indian studies that have been done. So what are the measures that have been taken globally and in India, that is worldwide, US, India? So this is the graphical representation where the it is legal, illegal, ambiguous graphical representation. So it states that 24 countries, they recognize LGBTQ as third gender. 24 countries. 133 countries have decriminalized. 133 countries have decriminalized homosexuality. India being one of them. 32 countries same-sex marriage has been made legal and Netherlands was the first country to legalize. Netherlands was the first country to legalize. 64 countries still have laws that criminalize homosexuality. Okay, their homosexuality is still considered a crime, and 34 countries, they provide some partner recognition for same-sex couple. So what are the measures taken by the government of India? So the Transgender Persons Act 2019, uh, Transgender Person Rule 2020, National Council for Transgender Person, and SMILE, which was a program by the Ministry of Social Justice and Empowerment. So these are the major steps that have been taken by the government of India in the upliftment of the LGBTQ community. I will be discussing in detail about these. So, what is covered? Okay, so in this act, Transgender Persons Act, which includes transgender, intersex population, so they have the provision for the recognition of identity, provision for formulation of welfare schemes, non-discrimination, education, health and employment, provision of right of residence. These are covered under Transgender Persons Act. SMILE program, which is by the Ministry of Social Justice and Empowerment. Okay, SMILE program has been given by the Ministry of Social Justice and Empowerment, and it has the following uh, welfare schemes. So first is recognition and appreciation of the population, skill training and scholarships, Garima Greh or the shelter homes. Garima Greh are one kind of shelter homes. Health insurance for this, TG certificates, that is the transgender certificates, and ID card, which is through DM. So they have to apply it twice. Uh, First as TG certificate, transgender certificate, and after that, when they successfully do the undergo medical assistant sexual reassignment surgery, then they can opt for male or female sex. So they have to apply twice the certificate through the DM of their area. So, what is the role of psychiatrist uh, when we are examining the individual from LGBT community, or we face LGBT community? So, we must familiarize. We should know what are the mental health concerns, mental health issues, prevalence, how to assess. We must be knowledgeable. Okay, we must know what is the uh, how to assess, what to discuss, and how to discuss. So we must know about the current rules, laws, advocacy, public policies, and there must be a gender affirming environment. While examining, we should begin by asking open ended questions, okay, and be non judgmental, obviously, non judgmental attitude. And we should neither be coerced to give our opinion or our moral views, and we should not impose on them, okay. This is really not advisable that we should impose our views on them. And there is a big no for any kind of conversion therapy, okay. No ECT, nausea causing drugs, hypnosis, hormonal castrations. This is pseudoscientific and have been refuted by the NMC. So there is no role of conversion therapy. This has been obsolete and abolished. These are some of the points which state how can you be an LGBTQ ally. So take care of people in the life who need support. Let them speak for themselves. Learn about the issues that they are having. Encourage your family members and friends to be allies, and be visible that you support the community. So there are some things that can be done at a very basic level, such as exposure and awareness at the community level, at school level. Since the very beginning, when a child learns, if we expose all the issues at that level at a particular age where they are sensitive to it, they can really help in major changes. So what are the current affairs on the same-sex marriages? So currently India does not recognizes same-sex marriages, though they can attain rights and benefits and live in as a live-in couple. They can live, and hearings ongoing in Supreme Court with various stakeholders. But as of now, same-sex marriages they are not legal in India. In India, same-sex marriages are currently not legal. So what are the various petitions? What are their points that they are discussing? They are arguing. So there are various stakeholders for and against. So I will be discussing about the points that are for and against. So the points are against the various stakeholders that have put up in the Supreme Court is that citing religious and cultural beliefs, they state that changing the traditional definition of marriage is against the fundamental principles. It is against the order of nature. Same-sex marriage is against the order of nature. There can be difficulty in inheritance of tax, property rights. This will make laws on adoption and surrogacy unworkable, and it states that how a same-sex marriage they will rear a child, and what a child will feel when he or she will identify that the parents are from the same sex. So what will be on the mental development of the child, and they state that gender can be fluid but motherhood is not. So these are the points that are put forward by those who are against it. Now the points that are by the for, they say that the laws and rules must be same for all. They say that marriage is between individuals and not male and female. This will only strengthen the families and communities. This is legal. Same-sex marriage is legal in many countries, and if we deny it, this is against the global principles. Marriage is between spouse, like I told earlier. Why same-sex couple could not adopt when a single parent is allowed to do so, and we have gone beyond motherhood to parenthood. So these are the points that are discussed in the Supreme Court. Meanwhile, Indian Psychiatric Society in its official notification has supported same-sex marriages, and they have said that there is no evidence to indicate that individuals on the LGBTQ spectrum cannot partake in any of the activities that are taken by the other community, and they say that discrimination will prevent and above and may lead to mental health issues. IPS is very cognizant that a child adopted into the same gender may face challenges and stigma. It is imperative that once legalized, such parents of the LGBTQ spectrum bring up the children in a gender neutral, unbiased environment, and it is of utmost importance. This is the statement given by the LGBTQ community. So, what is the way forward? Any legislation or judicial discussion, they must consider the cultural sensitivities while also ensuring that fundamental rights are protected of each and every individual. Education and awareness should be developed to promote acceptance and understanding, and same sex marriages can be considered on the table. India is signatory to various international human rights treaties which requires to protect the rights of individuals including LGBTQ community, and we as medical specialists, as psychiatrists, we can play in recognizing the individual and specific needs of the group while providing advocacy when possible to close that health gap. And obviously, as leaders in Asia, Indian psychiatrists are well positioned in this domain to improve the health outcomes of the LGBTQ community. Thank you. And as you can read, the being gay is like being left-handed. Some people are, some people are not, and nobody exactly knows why. It is not right or wrong. It is just the way things are. And I would again thank SlidesGo and FreePic for the infographics. Thank you. You can comment on the any clarification, any doubts or corrections. Thank you.